So we're here at the Healthcare Scene After Party with Alan Portela, CEO of AirStrip. We just talked about really accessing near real-time patient data in and out of the hospital and his work at AirStrip, really to make that possible. So this is the after party, which Alan's never done an after party with us. So this will be his first time. You never know what's going to happen. That's the beauty of the after party. But we already have some questions, and anyone that's watching live, I know there's a bunch of people, Chuck and Jimmy and Jess and Ryan and et cetera, et cetera. If you guys want to hop on, there's 2 open seats. You can hop on and add your own questions or insights. We certainly welcome you. But Manish, he asked an interesting question maybe we could start off with. He said, how can the healthcare industry move to a platform, and he does IoT, Internet of Things, that can interoperate between various hardware solutions? Any thoughts on that?
Well, I can see the picture now. If you look at the way we started at AirStrip, and let's use the example of cardiology. A patient is coming in an ambulance using the defibrillator from Physiocontrol, Zoll, Philips, and others. It goes into the emergency department, and there is most likely a cardiology system from GE. Mm-hmm. And if that patient has a full blockage of the artery, then that patient will go to an intensive care unit after the cath lab. And maybe that intensive care unit will have monitors from Space Labs, from Philips, GE, Nihon Kohden, and others. And then eventually we'll go to step down with a Sotera wireless monitor and go home with a patch from CardioNet, Vital Connect, TwoSense, you name it. So what happens is those are all different hardware devices that are the actual medical devices. By creating the ability to re-render all that data and create a front end, what we did is we commoditized the data source and allow the healthcare providers to be able to leverage from their existing infrastructure rather than have to replace everything with one vendor solution. So I think that we have done that a lot. That creates a lot of controversy, of course, because every vendor will love just to sell their hardware throughout the entire enterprise. We do the same thing with how we visualize the data. We started with RIM, then we went to Microsoft. We started with Windows in 97, then we went to Windows Touch.
RIM is BlackBerry for those that are following along at home.
Actually, I think we have about 40,000 users, and the last time I checked, there are still 2 BlackBerry users that are using our application through BlackBerry, and we have the names, and we know where they live. So the issue is we run natively on Android, iOS, on Windows, and we want to provide the same user experience to everybody, regardless of the form factor. So again, I think once you open up data, all the data sources and platforms become commoditized.
Interesting. Well, I think you described the opportunity, but also the challenge working with so many vendors. And I think that's what Manish was getting at, is that there's so many, and how are we going to integrate them into one platform?
I'd like to ask a question, and then I'll get off and let someone else get on if they join.
So this is Chuck Webster, otherwise known as Mr. Workflow.
I'm an industrial engineer who went to medical school, so I'm interested in workflow. This question is, at the recent several HIMSS conferences, I've seen vendors, let's say messaging, speech recognition, and including device communication, in which folks are starting to more intelligently manage tasks through notifications, through various kinds of engines that are consulting various kinds of representations of workflow, of work, hierarchies, escalation, starting to combat some of this alert fatigue through more intelligence. And but I'm interested in, there's what you said earlier is that it would be great to have a kind of a single view or a single layer that makes things more coherent, highlights the stuff that's really salient, and makes makes this data actionable, so that the notification, for example, on a watch, which is like, okay, I got it, thank you, or make it so, or hold that thought till I see you again. I mean, that kind of stuff. And so I'm interested in why is this area, why is AirStrip kind of a logical person or vendor rather to provide that layer of workflow user interface?
Well, so Charles, I know that we had good questions, and we will have good questions coming up, but I have to say this is the most important one for me, because you started by saying that you're all about workflow. And I want to spend some time on this, because this is a very important point. When the industry talks about interoperability, everybody's taking a standards-based approach, basically saying, well, this is how much data will be exposed on CCDA, HL7, FHIR, IHE for medical devices, but nobody is asking the question of what are we trying to accomplish? Which workflow are we trying to satisfy with the data that we are extracting from all these systems? As a result of that, we decide which parameters are going to be extracted, but nobody is benefiting from that, because if you're trying to look at every workflow, one clinical workflow, one workflow at a time, you're going to see that the standards of today only cover 40% of the required data elements. So what we do at AirStrip is we take a workflow-based interoperability approach. Mm-hmm. We go into each customer, and they understand the tools that we have today. But we say, if you were to automate and innovate an existing workflow, what would that be? And I will give you one example that for me was very telling. A customer said, well, we have one of the biggest NICUs, neonatal intensive care units in the country. But what happens is that there are two cases that we have to fly those kids to a metropolitan hospital because they are the only ones that have the specialists to be able to deal with that type of condition. But some of those kids cannot be flown because they're not in a condition to be flown to that academic medical center. So they came to me and they said, if you can give me all data that is charted in the neonatal intensive care unit for documented vitals, intake and outputs, fluid balance, arterial blood gases, physician notes, if you can combine that next to imaging data with diagnostic quality, and you can bring video conferencing and the actual data from the medical devices all into one view, so those doctors at the academic medical center can virtually take care of these patients, that is going to completely transform our workflow moving forward and save many lives. So when they're explaining that to us, you go through the entire workflow and you say, okay, I can give them all the ancillary data through HL7. There is no previous data because these are just newborns. So you don't have to go historically about data from CCDA, from a physician's office or anything like that. But you look at the monitors, well, they either have GE, Philips, or others. You look at the EMRs, they are going to have the data from Cerner, Epic, Meditech, and others. You bring video feed. You can put all that together on one platform and significantly impact that workflow. Then we go to the next customer. And maybe their need is to communicate ambulatory to inpatient. And they want to do something that goes beyond just CCDA, but be able to access data real time. If a patient gets admitted to a hospital, we want to look at the data retrospectively of what happened to that patient in the past using some of the industry standards. So everything we do, we take it one workflow at the time. And if we're missing one data element, because a vendor is not exposing that data element, we go to that provider and we say, can you fight with the data source so they can expose this? Because if I don't give you that data element, you are not going to be able to be successful because your workflow is not complete.
Yes.
And this is where we were talking about Apple earlier. This is when Apple designs its manufacturing workflows, they start with the prototype product or service, and then they work backward to figure out the steps of workflow necessary to create it. And some of those resources are data. And,
yes.
And so we need to go from the workflow to the data. Anyway, I'll sign off. Wonderful series. And Alan, nice to see you. And I'll let someone else sign on, or Jim ask a question. Glad
you could join, Chuck. Jimmie, you want to hop in here?
Yeah, just for a second. I've got a patient showing up here shortly, and I just Alan, great discussion. And I'm an internist here in Great Falls, Montana. It's a rural state, only about 1 million in population, and I've been using an approach for the last couple of years that I call projected EHR, and I've essentially turned my electronic record into an interactive visual tool and trying to use as much real-time data at the point of care to interact with the patient in the exam room. And I think, compared to how I was doing things several years ago, how you're describing that front end ability to stream in all this information, real-time information, and using telemedicine and being able to do that in real time is kind of my next challenge here in the office, even though it's much simpler and cruder than what you're describing. And I've got a portal operation with about 800 patients out of 1,100 active. And what I'd like to do is now institute telemedicine on top of that to my existing Medicare complex patients who have taken to the portal quite nicely. But the question, or I guess comment I have for you is that I have noticed that if I have any big gaps of information when I use this type of a method, it's as you described, you get a hole in your data, the patients see it right in real time with you. And you have to have a means of ability to fill that data stream essentially instantaneously. And what I've used, it's not the EHR that does, it's the health CRM that I use. And I've got a nurse that manages that quite well. So that's how I've gone around, this whole idea of interoperability. And in my opinion, it's not going to be achieved by the electronic records. It's going to be achieved by other types of mediums. And the health CRM in a small office has worked tremendously well for that. So how you're describing that, I found extremely true with the type of approach that I've developed here. So,
well, congratulations, because what happens is you manage to use the tools that you have to accomplish the best possible results. And I know that part of the question was also about reimbursement. I saw that there was a mention on who is going to reimburse this.
Yes, telemedicine.
Yeah. So the reality is that we are seeing how there are a new number of, telehealth reimbursement bills are being proposed in Congress right now. And I'm hoping they pass, because there is, as we were saying earlier, the fact that we have so few caregivers and so many patients coming into the system, if we don't find a way to get reimbursed by being able to provide remote consults, we are going to implode as a system.
I agree. I'm going to hop off. Nice meeting you, Alan. Great job, John. And I appreciate the time to ask some questions and hear you all out. So thank you very much.
Thanks, Jimmie. It's always great when a doctor hops on in between patients and joins us. So, there was another question from Manish. I'll put it up on the screen. He says, "Are you planning on using machine learning for prescriptive analytics?" And he puts Watson ? Which I think Watson's been branded so well for that. But we talked a little bit about this in kind of the formal interview. You want to go a little deeper on that?
Sure. So let's talk about clinical decision support tools and call that as the category, and then figure out exactly what are the things that are as subcategories of that. The most important one that I mentioned earlier is real-time processing engines. Is the ability to analyze data in motion, to be able to extract, using the right criteria, extract the relevant data. Then you look at clinical algorithms that get applied on top of that data, and then you look at analytics engines that come into play. As far as cognitive computing, which is what Watson does, I believe that Watson is going to be a very, very strong tool. I look at Watson as having a very smart kid that is about to go to college and learn a lot. And I'm really counting on them once they graduate and they assimilate all that knowledge that they're going to become very useful. But between now and then, you need to train Watson on each specialty: cardiology, diabetes, neurology, etc., etc. And those tools are going to become very important, but I look at that as more as a 2 or 3 year process. In the meantime, we need to apply those algorithms that we were discussing earlier. We need to develop new ones that can have immediate impact on the data that we are ingesting.
That's a great analogy. I kind of like that. Watson's a bright student who's about to go to college, and I hope he's successful and graduates because we need those type of tools, right?
Yes.
That's great. But it looks like Carl's on. It looks like his video's off. Is your audio working, Carl?
Yes, I can't figure out how to get the video on.
No worries. Well, we have about time for one more question or comment if you want to kick it in before we hit the hour. Or we lost him, maybe.
No, I haven't been listening long enough to have a question. I can't get this is my first time I've visited this venue here. I guess I need another video cam that works.
Yeah, no worries. Well, we'll be sure to do one again.
I just want to jump on because I've read blog posts by Walter Kierstead. He's an expert on workflow technology, and your question, or my question to you earlier, Alan, had to do with this idea that we need a kind of a workflow usability, workflow user interface layer. And I know that I'm sorry that Walter wasn't here for the entire thing, but I'm glad to see Walter on, and I'm glad to see Alan talking about workflow interoperability.
Yes, and it's interesting because earlier on, I was talking about how we pick technologies for visualization. We were talking about the Apple Watch, we were talking about the Apple TV, the iPhones, the tablets, how we also do that available on we bring data available on desktops. We took the same approach. We said, what is the workflow that we're trying to satisfy, and what technologies will enable this workflow? The same thing we use as far as data. What data will enable this workflow? So everything that we take as an approach is bringing our solutions as a workflow platform. And I will tell you an exercise that was very interesting. About a year and a half ago, I asked the team to come up with one sentence that describes what we do. And it had to be one sentence. So we made it very long, but it's one sentence. And we are a mobile interoperability platform that enables care collaboration and serves as a catalyst for customer innovation. So it's a mobile interoperability platform, workflow automation, and workflow innovation. That's what we're all about.
Thank you.
Perfect way to wrap it up. I know we're at the hour, so I like to keep these to an hour for everyone watching live and also for the people watching the recorded version at home. So I want to thank our expert today, Alan Portela, CEO of AirStrip. If you missed the conversation, only saw part of it, you can check out all the videos at healthcarescene.com. Thanks, Alan. Thanks, Chuck. Thanks, everyone, for watching live.
Thank you.